Hi, and welcome to the Global Professionals in Portugal show. My name is Cordelia Blake, and today's guest is Michael Averbukh, the CEO and founder of Serenity Healthcare in Portugal. Michael, thank you so much for being on the show.
Hello, it's a pleasure being here.
Your company has helped a lot of people. So I wanted to learn more about your journey as a doctor and a entrepreneur. Tell us a little bit about what you do.
Serenity was imagined and thought of by my partner and I while we were both in managerial positions in a hospital in Angola. You said it, my background is purely medical. All I do all my life, since the age of 4 or 3, that I decided that I want to be a doctor is being something around medical profession. And in the last position that I held as an employee, the idea was to make the next step structuring your own idea, your own dream. And luckily, I found a great partner. As I said before, we both worked in the C-level management of a hospital in Angola. My partner's name is Rita. She is from Portugal, and we thought of doing something together. We share a great passion for business and healthcare. And by the way, specifically a great passion for client experience. We found that Portugal has some great opportunities in creating a business around healthcare. And this is how the idea of Serenity was born. We started the company together 3 years ago. The idea was to create a platform that would help people in Portugal to overcome the hurdles, the problems, the bureaucracy, the complexity of this labyrinth of two parallel healthcare systems. We understand the problems of the system. We believe that we have the possibility to create solutions. And this is how we started, from a tiny room in a co-work space in Lisbon.
Mhm. I think sometimes when you see a business that's a little further along in its development, it's easy to think that it worked, right? But you and your partner were still in a tiny room in a co-working space, figuring this out at the beginning. How long did it take you to get from that space to like where you started hiring employees and felt like you had more of a company?
Everybody makes a lot of mistakes. So we made a mistake to start relatively big, or much bigger than we supposed to.
Okay.
The hospital in which we both worked, Rita was our client experience director and marketing director. I was the CEO. We had a team of 400 plus employees.
Mm,
So getting to like 4 was natural. We didn't need 4 at the
okay.
beginning. So we bled some money and we bled some effort, etc., until we started having some income. But then it took us a year. It took us a very long 1 year. Serenity didn't start as what we're doing today. We're providing medical concierge services mainly to expatriates. But the idea was a bit different at the time. Portuguese healthcare system is quite complex to understand. Not that it's bad, on the contrary, but
Mhm.
it's quite complex. And the many people that need the Portuguese system, when it's not about something urgent, when it's not about a multi-trauma case, you were just ran by a bus, or God forbid, you were just diagnosed with with acute leukemia. When it comes to where we all really consume healthcare, just going to see a specialist or just some blood tests or whatever, the basic things that we all experience in life, it really can drive you, sorry for my French, nuts. We decided we can really create a solution, but we decided to really try it. And we discovered that it's not so simple, just because our target clientele at the beginning of this journey was not willing to pay not even 5, 8, 10 euros per month for services that aren't provided by the state. And only then, after a long year of literally banging our heads on the wall, we found a niche in which we are today, and this is where the shift started. The ship started to take the right route, I would say, but it was a long year.
When you're in the middle of that year, I'm sure it felt super long, but from looking back, having a year to kind of feel out how your business is going to work is really not that long in terms of how businesses go. Most of us, when we found a business, we have this vision. You can't really unfold that and see how it's going to work until you actually start doing it. And then you're like, oh, I thought this would go this way, but it's going this other way. And so you went through that with your company. You overstaffed at the beginning. You had to find your niche, and I'm sure you're still pivoting. So you founded it. And then can you tell me a little bit about your sort of global journey? Because you said you were in Angola before you came here.
This is even a longer story. Well, I was born in Ukraine. My family immigrated to Israel when I was a kid. So practically at the end of the day, I'm in Israel. I studied in Israel, studied medicine, served in the Israeli army as a battle surgeon, specialized in internal medicine. At some point in my professional life, decided to combine management and clinical practice, which I did for 6-7 years or so. And then almost it started as a joke. Somebody offered me to manage a hospital in Equatorial Guinea. At the time, I didn't even know where it is. It's a tiny country on the equator. Went there, stayed there for 3.5, 4 years. Managed in parallel two hospitals there, and when it was about time to kind of go back to Israel, another Israeli group approached me and said, well, we have a project in Angola, in Luanda. I said, guys, I'm on my way back. And they said, well, it's only the beginning. Come over, stay here, make it happen, like open the hospital, run it for a year, and then we're good. And I came for a year and stayed for 6.5.
Okay.
But that brought me much closer to Portugal. Among those, as I mentioned before, 400 plus employees, we had quite a large staff, mainly nurses and physicians coming from Portugal.
Oh, okay.
Angola is a former Portuguese colony.
Okay.
So there's a lot of resemblance. There's a lot of copy paste in the systems. I thought it would be easier to blend into the Portuguese reality, at least language, which I spoke partially at the time that I arrived to Portugal. As I said before, systems are quite alike, regulation-wise and players-wise. So this is it. This summarizes 27 years of career.
So we had one of our other guests had a long career in another country before he came here. And we were joking about how all you have to do is work hard for 25 years and then you can be an overnight success. So now Serenity's been around for 3 years. Can you tell us what Serenity does?
Yeah, the formal statement, in a way, the slogan, if you want, is simply being your medical concierge in Portugal. But behind it, there's a lot of tiny bits and bytes. Practically speaking, and specifically newcomers to Portugal, when they are at a certain age where it matters. And it's not only about the couch to crash on at night and a good Wi-Fi and a cup of coffee in the morning.
Right.
Right?
I remember those days when I used to stay in a hostel and I was just happy if I had the bathroom to myself. And yes, emigrating when you're a grown up, when you come to a country as somebody with cavities and health problems and for maintenance.
You don't really have to be sick to take care of that.
Exactly.
You're just on some kind of a statin for your cholesterol or whatever.
Right.
And all of a sudden, in the midst of all of that, the visa and the bank account and the rent and whatever, you suddenly think, wait, like I have those prescriptions. How do I fill them out? right? Or
Hmm.
like it's about time that I had my mammography or colonoscopy or I don't know what. My GP back in the States said, well, I should follow on my PSA levels. Great. How do I do that
Right.
in this new country? So what we say and what we really do is like you're one phone call away from resolving all of that. It's about holding your hand through this process because sometimes very, very simple things can be really overwhelming if you just don't know where to go and you don't know how to express your will if somebody on the other side of the counter doesn't speak English. That's the issue.
Yeah, and I
Uh,
mean, I've spent years learning how to navigate the healthcare system in the United States. And so, like when my dad needed surgery, I was able to get him care because I knew exactly who to call and exactly what to do. But you move to a new country, and even if everything's awesome, you still don't know how to do that. So, full disclosure, we are clients of Serenity, and we've been very happy with our experience there. So, I reached out to Dr. Michael to come on the show, and he was nice enough to do that. But they have just been essential to our successful transition to living in Portugal, and then having options for people who want them if they want more care from you guys or if they want just help pointing to care elsewhere. It's just been amazing. I cannot imagine moving to this country without them. So we founded Serenity. It's concierge service. They help both with providing care if you need it, but also just pointing you to where to go for different things. They helped us pick out insurance. So I think you guys provide a lot of different services, which is great.
of all of our case managers are medical professionals. They're all
Mhm.
nurses. So it's not only about being our generation still remembers yellow pages or just being your
Right.
Google. Where's the closest orthopedic surgeon? Specifically, when you are in a new country and unfamiliar with the options of the system, you need to find a proper orthopedic surgeon. This is what differs us from any other service. This is what we do best. And as you mentioned, part of the services we can provide ourselves, specifically, of course, in Lisbon, as we are situated here.
I would love to hear some more about your founding journey and your business journey in Portugal. You were non-EU citizen. How did you actually start the business?
Rita worked out of Portugal for 10 years, and at least if I'm quoting her words, she came back to a totally different country, for better and
Okay.
worse, by the way. So for both of us, it was a new experience in a way.
Okay.
And making business in Portugal actually, it's a complex issue. It's like Don Quixote fighting the windmills.
Right.
So yeah, it's a demanding learning process, I would call it. First of all, it's starting a company with all the registration. There's
Hmm.
a process of how you register a company in Portugal with the needed paperwork, name, registry, starting of activity. Then, and this is where you touched a pain point: accounting. Accounting in
Hmm.
Portugal, for me, it was a traumatic discovery. It's actually finding somebody that you would pay, but they would work for the ATE, for the financial institution of Portugal. So you're actually supporting somebody to provide a technical feeding of information about your business to the Portuguese financial authorities. This is how it all works. And if you're
Right.
trying to find an accountant that would really support your business, it's a huge issue. For 3 years, we've been looking for an accountant that would be a little bit more of an accountant, a little bit more than a technical person or a group of people that would fit in one a little bit of support, a little bit of provision of financial advice, tax planning, whatever, you're in the wrong place.
If you want strategy to help you position your company, it's very difficult to find
You'll
here.
not find it, and this is
Mm.
practically what we're doing today. Another challenge was with banks. Try to open a bank account in Portugal without a residence card, almost impossible. So I was lucky enough to have an account prior to coming to Portugal. So we kind of managed to open a bank account in the bank that I worked with, but that was true obstacle. I just want to open a bank account. I'm not a criminal here. And then another thing that drove me at least crazy is the fact, just because I know a different reality, is like how the banking community is not open to support new businesses. This is another issue, actually. I mean, I come from a reality, and it might be wrong, it might be right. I don't know. It's different. I come from a reality of Israeli banking, where as long as you can really prove that you're not laundering money and you're a legit business and whatever, they would support you. They might not give you millions, but they would support you relatively easily with some first injection of cash, etc., etc. Specifically, if you brought cash from home to create your business. And we brought a huge amount of cash from home to put in a business. I will never forget the first meeting after we had managed to open a bank account, etc., etc. We had a first meeting with the bank, and I have to say that we, to a certain extent, even got lucky because the branch manager was willing to meet us. And he said, and then we presented the idea and we presented the business plan, etc., etc. And then he said, well, we'll be more than happy to give you a loan if you have the same amount of money in collaterals. And we said, like, yeah, but if we had the same amount of money in collaterals, we wouldn't be asking for a loan. Yeah. And yeah, I hear you, but that's it. I mean, you want, I don't know, 100,000 euros, you have to put 100,000 euros aside as a collateral.
Right.
What? But you know what? If you're going to be kind of nice enough, we'll put 120,000 euros when your collateral is only 100,000. Or that was the kind of the benchmark.
Yeah.
And I was shocked with that. And I have to tell you, by the way, 3 years later, we are a business with a track record, with profit, not a huge profit, but a profit. And we're not laundering money. You can look at our reports, etc., etc. And it's still the same, almost the same conversation. The conversation now is much more favorable in a way, and I understand it. It's totally okay. It's totally okay that when you come as a very new business into the market, the banks for sure look at you with a certain approach of suspicion. It's okay. It's very much okay. But like at least what I have experienced, that there was no true will or enthusiasm to give you this kickstart, and many new businesses really need it. In my perspective, this is part of the Portuguese reality. Again, I have to respect the perceptions and the way that business world here runs their business. It's a bit more conservative than I would like it to be. The system as a whole doesn't really think creatively out of the box. Like if you come with a new idea, it's not necessary that people would like it. Why should we do something that we never did before? I think that the country should think about, encouraging new businesses, encouraging new ideas, encouraging promotion of assets that they have here. I mean, human capital assets that leave this country just because they can't find themselves here. We have today 6 case managers, all of them, we found them and we're grateful for finding them, just because they didn't fit in what the system here has to offer. We were happy to interview a person that came and said, well, I'm looking for a new job because I just don't fit.
Mm-hmm.
For us, it was a gift in a way when a person came and
Right.
said, well, I'm just, I don't know, tired, blah, 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 and I want a better salary, which is normal driver all around the world, and it was okay. But the people that we really ended up hiring were the people saying, look, I just don't fit. All
Right.
the reasons that people look for new endeavors in their lives, but it was just because they couldn't fit in. As soon as somebody said that, okay, now you got my attention. It's a matter of the structure and the culture of business. I think it doesn't encourage enough the people that have the guts to do something different. And this what moves industries. This what moves economy.
Mm-hmm.
This what moves whatever, everything, growth, through huge amount of mistakes, through huge amount of errors. But this is how you have to encourage people. These people aren't being encouraged and promoted enough. You need kind of the leaders of a
Mm-hmm.
healthcare organization to be creative and think of new ideas and make things improve and better, whatever. But at the end of the day, if you think of medical professionals, it's pretty conservative. This is a true story of one of our nurses. The reason that she's looking to switch from her current job at that time, is just because when she worked another overtime of 15 or 30 minutes because she couldn't leave her patient that was under her supervision without finishing their IV drip or without taking care because the patient just started eating when she was
Right.
about to go home and she stayed another 15 or 20 minutes just to see that the patient is doing well, and where the chief of this shift said, like, why are you staying overtime? It's a bad example for the rest. You should go home on time. And she said, I can't leave my patient. And
Right.
that created a clash. This is
Mm-hmm.
not about thinking out of the box. It's being totally confined to some rules that are not only the rules of the game, these rules literally do not let you do anything, even
Mm-hmm.
if you by yourself contributing for your own time, your own initiative, your own will to do something better, and then the system tells you no.
You have those people that go the extra mile, and I'm so glad that you've provided a great environment for them. That's a wonderful thing. So
I hope you'll have to ask them.
can you talk about some of your wins and maybe the lessons you've learned from those that you can share?
Well, it's always harder to talk about the wins. I think it's important for people starting a business in Portugal. There are great people in
Yeah.
Portugal. I think that our biggest win is our team. We have great,
Mhm.
great, great people. It's great to have a team that is dedicated, that is concerned, that really cares about what the company does and brings their hearts to work every day, not only their brains and their professional experience. I think that this
Mhm.
is a great win. If I look back, it was a devastating process of getting there, but
Yeah.
when you look at the big picture, we're just 3 years out, and we're doing okay. Uh, One of the biggest wins is what people say about us when we're not present there. But places in which we aren't present and people speak well about us is a great win of ours. And it's not like we're free of mistakes. It's about tangible things. So we're not selling ice cream. Not everybody ends up very happy, but the very vast majority, like percent of the times, we're good and we're appreciated for what we're doing. This is
That's
great.
great.
Yeah. And again, we're very, very far from being perfect.
There's no replacement for just doing it and learning from your mistakes.
This is why I'm always saying to all of our team members, whatever, if you kind of Do whatever you think is right. Don't invent. Don't do all the mistakes in the world. If you're doing those mistakes, trying to do better, so okay, so then call back, say, look, we went wrong. Let's start doing it from scratch. It's a good tuition to pay just to make mistakes, but improve and don't do it twice.
And it sounds like you pretty much self-financed your business, that you were not able to get a lot of funding, and so you kind of had to bootstrap your own business.
Absolutely. We did not bring any single euro that wasn't from our own accounts. We're very, very actively listening to our clients, and we understand their needs, and we adapt our business and future business plans to those needs that we either identify or they just emerge as we go. And we really want to structure further business towards those needs that are still unanswered, and unanswered needs create huge opportunities.
Mm.
So I think that this is another big gain. We really want to grow and provide much wider extent of services answering needs of our current and future clients. For that, we will need a little bit of funding and support, investment, partnerships, whatever. So we're actually actively looking for that right now. It's a working company with track record, with some
That's
kind of a
huge.
reputation, with whatever, yeah. And this is much more than a crazy idea of two people that just decided to start something. So I believe, I want to believe, and I truly hope that our position today is a better position for somebody with some other resources, financial and other strategic thinking about healthcare in Portugal, to step in.
This podcast is sponsored by High Score Strategies. We do business valuation and strategic advisory. So we help companies increase value. We help companies attract investors. We help companies present themselves. And we have years and years of experience doing that. It is a real challenge when you get to the point you're at. You know, you've bootstrapped, you've gotten to where you can go. And there is a point at which sometimes bringing in a partner or an investor or a loan, like making that decision whether you should take debt or you should get an investor, and how do you position that? It's a challenging decision when you're also in the middle of running your business. So that's what we do, is we help people with that. FYI. I love your lessons learned. And, you know, I love the fact that you guys are in the middle of doing really a great job at your business, but also really trying to figure out how to grow at the same time, which is, I think, the startup journey, right? You're swimming and trying to how to swim faster, but you can't stop swimming because you'll drown. I think it's something, no matter what business you're in, we share that. So,
Absolutely.
well, Dr. Michael, thank you so much for being on the show.
Thank you for hosting me this morning. Well, come in with a lot of patience. I think that it's correct everywhere when you are in your business, but it has to be especially correct in Portugal because of the culture of business here, because you will need it. You'll need to wait for a response to your email from the bank for a couple of days. If you expect it to happen in a couple of hours, it ain't gonna happen. And it's not because they're bad people. It's just because the way the culture here there works. Nothing is urgent. There's nothing that cannot wait till the, next week. It's all good. So patience is a key, I think. Yeah.
Okay, that's great. Thank you so much. And thank you guys for tuning in. And please, if you have questions for Dr. Michael or questions for me, put them in the comments and we'll definitely respond. Thank you.